When faced with an emergency, it is important that you follow a structured series of events. This will assist you with providing the safest possible approach to the patient. The safety of the rescuer, the patient, and any bystanders will rely on you carrying out a dynamic risk assessment called Scene Survey. This Scene Survey will help you to determine if danger is present and the level of risk you may encounter when responding. These risks may include specific hazards such as water, gas, chemicals, fire, electrical, confined spaces, and unstable surroundings. Other hazards may be present, including moving equipment, vehicles, plant and machinery. Appropriate exposure protection will help reduce the risk of infection from communicable diseases. When it is safe to do so, act. Your only available action may be to call the emergency services and wait for assistance to arrive. Dial 999 or 112. Give a clear description of the situation and location. Establishing priorities will include getting help from others and treating patients with life-threatening conditions first. To assist you with making the decision as to whether or not it is safe to provide immediate first aid, we've developed a clear and simple method of surveying the scene of an accident or medical emergency. The memory prompt, Scene, will help you to make sure the patient, any bystanders, and you are safe. The word Scene stands for stop, check for danger, exposure protection, know obvious risk, and establish priorities. Always remember that the scene of an incident can be the biggest challenge when trying to provide aid to an ill or injured person. Do not let the sense of urgency make you feel under pressure to respond. It is critically important to assess the scene. Let's look at scene in more detail. Stop. Look, listen and think. Review the scene. Is the scene itself dangerous? Could it be the reason the person became a victim? If so, you must protect yourself from becoming a victim also. Check for danger. Is the environment at the scene a possible hazard? Do you have the appropriate clothing and equipment to protect yourself and the patient? Consider your limitations. Are there any specific hazards? Check to see if there are any gases, chemicals, fire or fumes in the area. Is there any possibility of an electrical hazard? Is the patient in a confined space or unstable surroundings? Your own safety must come first. You are no help to the patient if you are injured. Is there any moving equipment at the scene, such as vehicles, plant and machinery? At the scene of a road traffic collision, consider the movement of traffic. Use your vehicle to help protect the patient and your hazard lights to warn other drivers. If available, use bystanders to direct the traffic and call for help. Remain alert to the hazards presented by other traffic. By controlling the traffic, you will reduce the hazard to yourself and the patient. Exposure protection. In some circumstances, the patient could also be a hazard. The patient could be a carrier of communicable diseases, such as hepatitis or HIV. Take time to protect yourself with gloves, face shield, pocket mask and mouth barriers. It takes less than 60 seconds to put on protective barriers. No obvious risk. If it is safe to do so, approach the patient and begin first aid. Establish priorities. Treat patients with life-threatening conditions first. Those making the most noise may not be the most seriously injured. Remember, scene means stop. Check for danger, exposure protection, no obvious risk, and establish priorities. By carefully assessing the scene, you may provide valuable first aid to your patient without endangering anyone, including yourself.